So lumbar disc herniation and lumbar disc bulge, yes, these are conditions that we deal with on a regular basis within our office. And alongside chiropractic care, a very important piece to the recovery is also the exercises that we prescribe to all of our patients, all right? So it's important to not only help with pain relief to prevent injury, but then on top of that is core stability is a very, very important component to making sure your back is safe from a lot of the everyday activities that we do, right? Yeah. So I'm Dr. AJ.
And I'm Dr. Ongko. We're both chiropractors right here in Mississauga, Ontario, Canada. These are science-based exercises that are good for core strength, right? And to protect your spine and also to help you rehabilitate yourself from lumbar disc injury and lumbar disc herniation. So we can attribute some of these exercises to Dr. Suharto Ongko, his recommendation for protecting your spine.
Now, remember to refer back to some of the previous videos we had. We brought you some other exercise videos in terms of pain relief and also for some preventative exercises as well. So check them out just right over here. But on top of that, don't forget to like and subscribe, and then also turn on that notification bell as well so you're the first to know whenever our videos come out.
That's right.
All right, so let's get into this.
Yes, sir. So the first one is the curl up, right?
Yeah, so we're gonna get into the curl up here. So with this exercise, in terms of your setup, what you're gonna do first is with the knees bent up like this, you're gonna have your hands behind your lower back, okay? Now the purpose of this is actually to help protect your lower back and to maintain the curvature that's supposed to be there. It prevents you from flattening your back when you're getting into this exercise, all right? So for the purpose of this exercise, what we're going to be doing is activating mostly into the upper portion. We're trying to spare the lower back as much as we can. So with one leg bent up like this, we're going to have the other straight out like this, all right? We'll get into some variations with that afterwards. But the general movement of this is mostly, again, up into the neck and into the head. So we're going to keep a stable spine. So the spine is going to be straight throughout this whole exercise. And all we're going to do is bring the elbows up, so almost like you're flapping your wings here. You're going to keep them up into the air. And then from that, you're going to lift the head and a bit of the shoulders off of the floor, all right? So a good way to think about this, what Dr. Stu McGill had pointed out is when you're doing this exercise, imagine your head and your shoulders are on a scale and all you're doing is lifting it up lightly so that the scale goes down to zero. You don't want to do grand motions, bringing your whole torso up, kind of like a sit-up, because that actually activates places that are not supposed to be activated for this, all right? So again, the premise of this is not to feel too much load into the lower back, all right?
So you should be doing what I just did there, which is turn my head.
Right, and that too. You want to keep it stable and looking up. So as you can see, as he's going through this motion, most of this is just a hold, right? So you want to hold this for up to 10 seconds at least. You can go anywhere from 8 to 10. But again, if this is your first time doing this, think of your tolerance, all right? You can start as low as 5-second hold, but eventually you want to work your way up to 10, all right? And with the repetitions, basically what you want to do is start to maybe about 4 repetitions and work your way up to maybe 6 or 8, just progressively increasing as you can tolerate, okay?
Just as a variation, there are some of you that actually have shoulder issues, which means that it's quite difficult to actually bring your shoulder forward. And what Dr. Suharto Ongko has at one point talked about was to actually put either a towel or in a foam such as this one. And again, you can actually just put your hands right on top of your belly, do the exact same thing. The whole idea is that make sure that you're just lifting your head just slightly off the floor, and you just tighten up your whole core here as you're doing so, holding it right up until around 10 seconds.
All right, an important piece as well is thinking about the leg position as well. So remember, typically when we do this, we have one leg that is straight out while the other one is up. And as you go through your repetitions, you can alternate back and forth, so you're using both legs. However, for those of you who are dealing with any leg pain at all, whether it's knee or stuff going down into the legs, you want to spare that leg as much as you can. So that's the leg that you're going to keep bent, and then the other one you're going to straighten out as a stable base, all right?
Okay. Just remember, if you have lumbar disc herniation or lumbar disc bulge, and any of these movements are painful to you, then you stop, all right?
And of course, talk to your healthcare provider and have a better understanding as to why that's happening, all right?
So for the side bridge, right, you're gonna make sure that you start on the elbow, right? Try to keep your spine fairly neutral, right? The top leg should be in front, and you're just gonna hold up your body. Okay? You can get somebody or to check your neutral position, make sure that your spine is straight, make sure your head is fairly neutral. So how am I doing there, Dr. Adrian?
Pretty good. And remember, a lot of the movement is coming up into the hip, hinging right in through here. But you're going to feel most of that activate into the sides, right in through here, into the muscles there. Now, there are variations to this. As you can see, some people might not be able to tolerate some of these. So a good way to start off with, right? Keeping the elbow up there. So progressively, you want to go up to straight leg. But some people can't do that. So what you can do is simply just go up to your knee, right? And just like that. And you're still getting the same activation into the muscles on the side, right? But then eventually you want to be able to progressively get it to a straight leg where you're just on your elbow and just onto your feet, okay? Now, there are variations for people who are dealing with shoulder pain as well, because you can probably see there's a bit of a load that's on the shoulder itself. So one of it is you can actually get into the wall and get into the position that way. But then also as well, what you can do is straighten out the arm here on the bottom, just so you're on your back, okay? And then with this one, what you're gonna do is actually with the straight legs, you're just gonna lift your legs up, right? Okay. And you're still going to get some activation into the side right over here, okay? So again, with these, it's all about the hold, all right? So you're gonna go 10-second holds at least if you can. I mean, you can go 8 or progressively work up to 10. And then again, working around 6 repetitions, working up to that on either side, all right?
That's right.
Anything else you want to add to that?
No, again, it's all about the safety and doing some of these movements. So you have to know yourself. If there's anything during the movement that's actually uncomfortable or painful, you have to know to stop. And again, make sure that you get permission from your healthcare provider. Make sure you get permission from a chiropractor to do these exercises and make sure that it's the appropriate one for you. What's the next movement there?
This one is called the bird dog, right? And you'll see why it's called that based on the movements that we get into here. So what Dr. Ongko is going to do here is get onto all fours, right? So on his hands and on his knees. Now with this, what's going to happen is we're going to have one leg kick out, right? While the other arm comes, the opposite arm goes straight, okay? So some important things to be mindful of here. We're trying to create a tabletop effect here. So with the legs, the arms, but then you want to be able to have a stable back. So what's important to remember is imagine if there's like a cup of water right here on his back. It should be stable enough so the water is not shaking, so it'll fall down, right? So you want to, again, engage the core muscles as you do this, all right? Activate them right into here so that everything is stable as you get into these movements, okay? So we'll get Dr. Ongko to try this out. So what happens with the leg first, we'll show this, is you kick it out. And what you want to do, what you want to be mindful of is kicking with your heel, all right? You shouldn't get any activation up into here because then you're probably bringing the leg up too high. So you want to have it at a good height where the activation is pretty much just in the glutes and then you can feel it as you kick your heel out. Now, while he's in this position, what's going to happen is the opposite arm is going to punch out, all right? And you really want to push that out as far as you can. So you're getting activation pretty much even down into what we call the lat muscles on the side of the back here, okay? Now, as you bring it back in, right, some people can rest if you need to, right? But then most of the time you want to progress to bringing it in and sweeping across, touching your knee, and bringing it back out here, okay? So with these, again, it's a hold is what we're trying to achieve here. So at least up to 10 seconds eventually, but anywhere from, again, starting from 5, working to 8, and eventually up to 10, 6 times on each side there, all right? So do you know any variations what people can do if they're having some difficulty with this?
So another variation for those that have challenges in just balancing yourself perhaps would be to start off with just either using just the legs first or even doing it with the arm, okay? And again, this should be a fairly difficult movement. If you find that it's too easy, it's because you were not engaging properly. So even with just the arm alone, you shouldn't just leave it out there in the middle. You actually should push towards the other side, you know, engaging all those muscles in your shoulder, and you should be almost shaking to the point where you're actually tightening everything up in the upper torso. Same thing with the lower half. So if you're just doing the leg, okay, you're kicking it out, everything's nice and tight as you're doing so, and this should be actually quite challenging, right? So on the next video, we're going to talk about sitting position, sleeping position to help you with your disc bulge and disc herniation symptoms.
And don't forget to like and subscribe to see more of our videos. Turn on your notification bell as well, just so you know when these videos are coming out. And don't forget to leave any comments down below of any questions or suggestions even that you have of any future topics that you want to hear from us as well.
Okay, and don't forget, a healthy spine is a
healthy life. Don't forget to like and share this video, and subscribe and click the notification bell to see our weekly videos.
To learn more about how Wellness Chiropractic and the Active Family Chiropractic and Wellness Center can help you with your chronic pain problems, please visit www.wellnesschiropractor.com.
The Active Family Chiropractic and Wellness Center is located at 80 Queen Street South in Mississauga, Ontario, L5M1K4.